The St. Agnes Hospital of Fond du Lac, Wisconsin was expanding with staff and patients. With this, there was a need of more nurse support. The Congregation of Sisters of St. Agnes opened the St. Agnes School of Nursing in 1910. This became an integral part of the St. Agnes Hospital overall operation and pioneered the way for nursing students with their 2-year nursing program. Under the direction of Sister M. Serafia, with 18 sisters as nursing staff, the St. Agnes School of Nursing pioneered the way for future nurses. The program grew into a 3-year program in 1918, at a time when the majority of nursing programs were either 1 or 2 years long. Although only sister students were admitted into the program in the beginning, by 1918, the regular 3-year program was opened to lay nurses. With the increase in patients at the St. Agnes Hospital, Sister M. Serafia stepped down from her role as director of the School of Nursing and called upon Miss Ava Collier, RN, to become the first lay nurse as director of the School of Nursing. With the increasing admittance of nurses, a move to the Gerhardt residence was necessary to accommodate living quarters for the incoming classes of nurses. The new residence, along with the 3rd and 4th floors of the east wing of the hospital, was dedicated toward living facilities for the School of Nursing. In June of 1921, the St. Agnes School of Nursing graduated the first class of lay students. 13 students, including 1 sister, graduated. Also, this class of 1921 created and published the first annual edition of The Nightingale, a senior yearbook to commemorate the graduating class and the memories made during their school days. The Nightingale would later be replaced by the Agnesian in 1931. Also in 1931, with the ever-increasing enrollment of new lay students and the assistance of the sisters, a new modern 5-story School of Nursing was constructed, creating ample room for educational and social activities, as well as 3 floors of living space. The 1940s brought World War II, and with that, the need for nurses and nurses' aides. St. Agnes School of Nursing accelerated their 3-year program to help accommodate for this need. By reserving the last 6 months of their senior year, the student nurses were placed in cadet assignments in military, federal hospitals, or home hospitals to gain experience. During the 5-year period between 1943 and 48, St. Agnes School of Nursing graduated 240 cadet nurses. Through including summer courses entitled Victory Classes, students were able to accelerate themselves through the program. The last class of cadets enrolled in September of 1945 and graduated in 1948. Of these cadets, 108 of the cadets served with the Army Nurse Corps, Navy Nurse Corps, and U.S. Public Health Service, ranging from 1 to 5 years of service in over 50 countries. The 1950s included the collaboration of St. Agnes School of Nursing and Marian College. Sisters Mary Agreda and Juliana worked closely with Sister Fidelis, president of Marian College, and Sister Muriel to lay the groundwork for students entering the St. Agnes School of Nursing. The program encouraged the freshman class to further their education to include receiving their RN at a Bachelor of Science institution. By August of 1960, St. Agnes School of Nursing had graduated 119 sisters and 1,199 laywomen. However, in 1963, the St. Agnes School of Nursing accepted their last class of students into their 3-year program, as Marian College, now university, was to absorb the program after the last class of St. Agnes School of Nursing graduates. The Congregation of Sisters of St. Agnes closed St. Agnes School of Nursing with the St. Agnes School of Nursing class of 1966 and merged the school into what was then Marian's Nursing Studies Division, with its students still using the clinical facilities at the St. Agnes Hospital. Marian's first class of nursing students graduated in 1968. In 1969, full approval of the transition was given by the State of Wisconsin Board of Nursing. Increasing numbers of students and faculty necessitated a move in the mid-1960s to the current 100-acre campus. In 1970, Marian became coeducational and graduated its first male nurses in May of 1974. By 1980, the BSN completion track for registered nurse students was formalized within the traditional day schedule. With 9 students enrolled in the first year, student enrollment reached the 300 mark. By October of 1986, the evening weekend BSN completion track was initiated, meeting the needs of working adult nurses in the Fond du Lac area. Library enhancements were made, linking campus library to nationwide computer networks. Extensive library consortia were established with other Wisconsin libraries, establishing a comprehensive library network for commuting and outreach students. Throughout the 1990s, Marian achieved 100% pass rate of nursing graduates on their RN NCLEX boards for 3 consecutive years. The number of nursing students continued to increase and increased to 430, an all-time high for the Nursing Studies Division. This increase added pressure to the demands of the core full-time faculty, especially within the basic track. In 1993, the Nursing Studies Division moved to Regina Hall, and renovation of the Nursing Resource Center in Regina Hall was completed. Student enrollment continued to increase, with another peak at 510 students, as outreach sites were started to accommodate students across Wisconsin. Also, as new courses were implemented, new clinical sites were utilized to give students hands-on experience. In the late 90s, the Nursing Studies Division worked with the chairperson of the Math and Natural Science Division to revise the curriculum to meet the needs of both divisions. In 2000, Marian again achieved a 100% pass rate on state board exams and even implemented the Master of Science in Nursing program. By April 2002, North Central accreditation for the Master of Science in Nursing was granted. On October 12, 2005, the Nursing Studies Division underwent another change as the Marian College Board of Trustees approved the name change of the Nursing Studies Division to become the School of Nursing. In 2006, Marian relocated the Nursing Skills Lab, Nursing Resource Center, to a remodeled new facility off campus and named it the Agnes Center. Also in 2006, the School of Nursing started a summer camp for high school students who were interested in nursing education. In 2008, Marian College became recognized as Marian University on May 1st. Today, Marian University School of Nursing program has grown to more than 750, with students coming from 14 states and 13 countries. Marian is a forerunner in the state for their parish nursing and palliative care programs, as well as with their degrees for RNs, including the RN to BSN MSN and MSN programs. During the 2009-2010 academic year, Marian graduated more than 115 undergraduate and graduate nursing students. Graduates of St. Agnes School of Nursing and Marian University strive for excellence in promoting the health and well-being of the Fond du Lac community, as well as encourage the education of area students who desire to continue this legacy of care and compassion.